This is Behind the Headlines, with behind-the-scenes analysis on issues affecting Pennsylvanians, sponsored by the Susquehanna Valley Center for Public Policy. Now, here's your host.
Hi, welcome to a new edition of Behind the Headlines. I'm Maura Donley, an associate at the Susquehanna Valley Center for Public Policy. Charlie Greenwald, our host, is on assignment, so he's not here with us today, but we're very fortunate to have Jere Strittmatter, a board member of the Susquehanna Valley Center for Public Policy, with us today. Thanks for being here and helping out.
To it. Yeah.
We're going to have some interesting discussions.
Oh, definitely, definitely.
I'd like to introduce our guest today. We're going to talk about healthcare, one of the biggest issues out there, and we have Mr. Andy Carter, who's the president and CEO of HAP. And you can say what HAP is because it changes.
It's very happily now the Hospital and Healthsystem Association of Pennsylvania.
Well, we'd like to welcome you today. We've got some great questions for you and find out what's going on with our hospitals. So, biggest issue, it kind of shocked me. The governor's budget includes a 60% tax increase on hospitals. Can you tell us a little bit about that?
Yeah, it's a shocking number.
Yeah.
Starting in 2010, we stepped forward to help the state address a budget deficit. And we did that by taxing ourselves a bunch of money and putting it on the table so that we could then attract federal matching dollars. Okay. The state takes its share. We call that its tax.
Okay.
And then the rest goes to taking care of Medicaid beneficiaries at our hospitals. So over time, the amount that has been going to the state general fund to help with the deficit has been growing. And in the governor's latest budget, which includes many good proposals, but this one is problematic because the amount going to the state would increase by 60%.
Is there, were you given any rationale for that dramatic of an increase?
Yes. The idea was that we are also able to increase the amount that we can put on the table and draw down more federal revenue to improve payments and therefore care for patients. So we are going to see some increase in the net result, but only if the amount the state takes is far lower than what the governor put on the table. The only rationale in the end is that the money is available and there is a need to finance government operations.
This seems to fall into one of those categories of no good deed goes unpunished.
Correct, and it just goes how there are so many problems. When we had the recession and when the federal government and the state government were fighting over funds, and they all want to tell everybody what to do, but they don't want to put their money behind what it is that they want to tell you in the private sector and also the states what to do. So the federal government comes up with these things to say, well, we'll give you your money back, but only if you draw it down, only if you contribute, and then we'll give you the money that you paid in. The federal government doesn't make any money, but yet this was a financial thing that got started with 10 years ago with the financial collapse that obviously is going in the wrong direction right now, and people aren't really looking at it correctly. Is there a way for our congressional delegation and the administration here at the state level to work together better to understand your good arguments?
Absolutely. We do work together on a number of policy initiatives. We can come back to this tax issue in a moment, but I'm very proud that the hospital industry is working hand in hand with the Wolf administration and the legislature to address the opioid crisis in Pennsylvania. Very important steps to improve access to needed treatment and recovery services. That's all good. In terms of working with policymakers on the financial challenges the country and the state have faced over the last 8 or so years, we think we're doing our part by putting all these dollars on the table. But the win-win dimension of it is what we don't want to lose sight of. We are happy to help resolve the state's budget challenges to the tune of, we're already contributing over $220 million a year. Over the last several years, it's totaled over $1 billion to the state coffers that our initiative has made possible. We just have to keep that in a box and not let the amount going to the general fund rob us of the potential for investing in healthcare. And I think it's pretty clear Pennsylvanians want and deserve a better healthcare system than they have today.
Well, what's going to be the impact if this tax goes through? What's going to happen to our communities and our hospitals?
If the proposal went through exactly as proposed by the governor, and we're working closely with the administration and the General Assembly to achieve a different result, but if it were to go forward, we'd see a reduction in resources going back to many of our hospitals. And that's a reduction in resources that we can't afford at a time when the financial stress on many of our members is getting worse. I mean, over the last 3 years, around 30% of our members have lost money each year. And that's not sustainable. And so we have people in communities around Pennsylvania, including our rural communities, who are justifiably very worried that their hospital may not be there for them when they need it most.
Right. There's critical care hospitals, and in sparsely populated areas or the poor areas, we really count on them. The distance would just be phenomenal. We've already had this paring back of so many county hospitals.
Yes.
And your association stepped forward and took care of all those people through different mergers or takeovers and telemedicine, all these things that we benefit from because of what you've done. So it just makes no sense to sort of kick you in the teeth and say, well, now do more with less.
I do want to commend the administration for its leadership in trying to address healthcare in rural communities. The Wolf administration has taken the lead in trying to develop a new pilot project to provide sustainable funding to select rural hospitals that are volunteering to participate in a new initiative. That's great leadership. I'm troubled when on the other side of the ledger we're taking a step back for the broader hospital community. And we just can't afford to do that when we have technology to adopt. Telemedicine being one, and there's actually exciting legislation we might have a chance to talk about. Second, we all want our healthcare information to be able to flow from one provider to the next very safely using electronic health record exchange. That's expensive technology for our members to acquire. And so it is not the time to be stepping back from these financial commitments to the delivery system.
Well, I heard that collections are going pretty well on the state level, so I'm going to cross my fingers that you don't end up being hit as hard as 60%, because that seems a little bit crazy.
Well, and we are trying to be reasonable, and we're not saying that the 220 million we're contributing now cannot grow. It just can't grow at the rate envisioned by some policymakers.
Okay. Well, let's talk about telemedicine and some of the other exciting issues you have going on, because it's not all about the money. There's exciting initiatives. So tell us a little bit about that.
I think what makes it exciting for all of us in the hospital community is how consumers are driving the train on much of this. It's consumers, particularly the younger generation of people beginning to use healthcare, who have expectations that they should be able to get access to healthcare on their smartphone.
Yes.
And hospitals are responding rapidly. They are working with app developers to have apps on their phone that allow them to schedule appointments much more easily, to find out the results of their lab tests. And an outgrowth of that is the ability to actually have access to diagnostic and treatment services through telehealth. And I'm very excited and grateful to Senator Vogel for his leadership in sponsoring legislation that would define really clearly what constitutes telehealth and telemedicine. And also, and here's the tough part, also requires that insurance companies pay for it if they're paying for the same services in a face-to-face encounter.
This is exciting news. How can people, all our viewers across the state, which are listening to you now, how do they get this information? Could you give us your website and let them know how they can access this and be better informed?
Well, my first step, I'm always happy to talk about our website because there's lots of information there, including information about how to figure out the quality and cost of healthcare. It's haponline.org. But I'd also urge every viewer to always talk to their physician or their nurse about how they can have access to telehealth. And there are great examples that people don't even necessarily think about. Let's say you just had a baby and you are one of many new moms who suffer postpartum depression. You might be able to have access to psychiatric support and counseling over the airwaves instead of having to go for treatment, and especially if going to treatment is a long way away. Dermatology can be examined with the quality of the cameras on smartphones today.
Really?
Dermatologists can take an initial look and identify whether you need to come into the office or whether they can prescribe treatment over the telephone. Those are just a couple of examples of the power of telehealth. And the trick is, it does incur a cost, and providers using these technologies have a reasonable expectation of being reimbursed. Many insurance companies, under certain circumstances, will pay for it, but we need to have a consistent set of rules in Pennsylvania.
Yeah, so about reimbursement, that's another issue that you get hurt by, because you take care of the people that come to your door. And the reimbursement level, you don't know from day to day, what that's going to be, what the insurance companies are going to take, what they're going to allow, what the government is going to allow. How do you deal with that, so well?
Hospital leaders are accustomed to providing the best quality care at the lowest possible price. We know, though, that journey is not over, and we are stepping up to the plate and taking responsibility for getting the job done with the resources available. And it's tough. Medicaid, for example, only pays about 81 cents on the dollar for the actual cost of providing care. Medicare for older Pennsylvanians and older Americans only covers 90% of the cost of providing that care. So we learn to try to do the best we can, but that's why we ask the Commonwealth to support us, particularly on high priority services like trauma, obstetric maternity care, burn care, and extra support for critical access hospitals that we talked about. That's another budget issue we have. The governor, again, an example of his leadership, his budget fully funded those special programs for those services. And we know the legislature has been a tremendous champion of these programs and of our critical access hospitals. So that's how we try to get by with some of those extra sources of support.
Oh,
and you mentioned those three items, the obstetrics, trauma, and burn. Those aren't new items for the budget?
Correct.
You're just trying to sustain those.
Make sure they stay in place.
You didn't ask for an increase? You should have asked for a 60% increase.
Well, we did ask for a modest increase to support critical access hospitals, combination of rising costs and a newly qualified critical access hospital. We need a little bit more money, total of $10 million to fully fund what we've been doing in recent years.
So a lot of these issues, including the telehealth issues, are really critical for our rural areas, correct, in Pennsylvania?
I think most Pennsylvanians realize...
It's not just the millennials.
Correct.
Yes.
Regardless of where the millennials live, Pennsylvania is a very rural state, and the distances between care providers can be vast. Travel times, particularly in the winter, extraordinary, and so we need to have strong access to care. But we can't deliver on that promise using entirely old ideas. We do have to modernize, and that's why we need things like telehealth.
Okay.
In the last minute that we have, what are the things should our viewers know that you'd like us to make sure we hit upon for your next visit here?
I'd say the most important thing for all your viewers to appreciate is that our member hospitals and the physicians and nurses and therapists that are staffing them want to work with each of your viewers as partners in their health care. The days of being a passive recipient of health care have to come to an end, because we know our own bodies better than anyone else. So I'm hoping viewers will sit up straight and realize that when they go to the physician's office, they're ready with their questions and they're ready with a point of view.
Well, it's so easy to be so informed now about anything. It's a double-edged sword, because you might think you're dying of something and you might be perfectly fine, but because you Googled it. But I think doctors are getting used to that now. They can handle what is a well-informed patient now, and that's nice. There's respect for that, but it still has to be a challenge for all the doctors. One thing I would add, though, too, to all the viewers should get a healthcare advocate, because when you're sick, you might not be able to be as prepared as you should be to help take care of yourself. So healthcare advocates are really important too.
Including family members.
Yes,
yes, absolutely. Well, we'd like to thank you so much for being here today and talking about these important issues, and we look forward to having you back again to continue this discussion, especially after budget season, and hopefully things will die down for you.
Great.
So,
thanks for your time.
Thanks for being here.
Thanks, Jere.
Stay tuned for the next segment of Behind the Headlines.
Behind the Headlines is brought to you as a public service by the Hospital and Healthsystem Association of Pennsylvania, helping hospitals provide healing, health, and hope to communities across the state. And by the Pennsylvania Chamber of Business and Industry. The Pennsylvania Chamber serves as the frontline advocate for business on Pennsylvania's Capitol Hill by influencing the legislative, regulatory, and judicial branches of state government. Additional underwriting provided by the Worrell Corporation Foundation, based in Carlisle, Pennsylvania, by the Edward H. and Jeannie Arnold Foundation, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business. Behind the Headlines is also supported as a public service by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Visit pahighwayinfo.org.
Hi, welcome back to a new segment on Behind the Headlines. On this one, Jerry and I are going to talk about local government issues, and we have
the expert here.
We do have the expert here, Mr. Dave Sanko. Welcome. Dave is the executive director of the Pennsylvania Association of Township Supervisors. You are coming off a really big, highly successful conference with all your members. Do you want to tell us a little bit about that yearly gathering, and then we want to talk about what came out of it?
Sure. We had about 3,500
Wow.
township officials from around Pennsylvania came to Hershey to hear, participate in over 80 different classes, sessions, learning opportunities for them. Hear some good speakers, set policy for the association, elect new officers, have a trade show. It was just a great learning opportunity with lots of networking.
Oh, that sounds tremendous. What are some of the big issues that they wanted to learn about or are hoping to be able to tackle in the coming year?
Well, I think there's, we had a panel on Wednesday morning on opioid abuse, which is simply touching every neighborhood. It's everywhere. We had the Secretary of Health, Dr. Levine. We had somebody from the Attorney General's office, a local law enforcement official, and then a mom who lost her daughter, who started a foundation, and talked about some of the things that everybody should be doing to help bring attention and awareness to that. But other issues that folks were talking about were unfunded mandates, which has always been
a big one.
A big one on the plate, whether that's from roads or stormwater or public records. I mean, there's just a lot of extra costs to come along with doing that. Broadband access across Pennsylvania.
Still an issue.
There are almost 1 million people in Pennsylvania who do not have access to broadband, and that's going to leave them and their kids disadvantaged economically, educationally, from a healthcare perspective, from a job creation perspective. Just it leaves a big group of folks behind. So that's been a pressing issue. The firefighters crisis is a big, as volunteers are starting to disappear, with stuff that they were talking about. But by and large, we also heard from House Majority Leader Dave Reed and Senate Appropriations Chair Pat Brown talking about state government and the hope of having a budget on time for the first time in I can't tell you how long, but a long time. And that's the season we're in.
Yep, sure is.
Predictability is so important for all our viewers. Gloss over about the fact that municipal officials, but local government is where rubber really meets the road, and that you're really there with all these local officials who get paid very, very little or nothing.
Sure.
And then when you take all of the different planning committees and zoning committees and emergency management committees, and then have to interact with all that, it's really amazing. So I just want our viewers to know how lucky we are with over 2,600 different local municipalities, and that you coordinate that and you get such an outpouring of people to come to Hershey. Congratulations. It's hard to get people to do anything like that. But I guess with your background with the state too, that's really helpful, and that they find it very useful, that you're going to have a good program for them.
It's a great effort. It's a team effort. A lot of people work all year round. We're already starting to plan for next April's conference. But it is something that people feel passionately about, and thankfully there are folks, as you said, who serve in local government because they can make things happen. Their residents can go and visit them and see them at the church or ball field or park. To get issues addressed, and the further you get, further away from that you get, the tougher it becomes to be responsive, whether it's to the county seat or the state capital or the nation's capital. I mean, there's just a lot of other pressing issues, and it becomes pretty hard to get folks in Congress to want to talk about a stop sign or a speed bump.
Right.
Well, you mentioned firefighters, and I was reading recently that in Pennsylvania we used to have as many as 300,000 volunteer firefighters, and we're down to 50,000 around.
Yeah.
That sounds like crisis level.
Well, I think in the 70s there was a report called Pennsylvania Burning, appropriately named, that documented firefighters and activities, and there were 300,000 then, and we are now down to maybe even under 50,000. And there's still the same amount of territory. There's still the same amount of things that you have to do.
We haven't shrunk.
There's actually more things you have to do
right.
that firefighters have to respond to now. So it's a very big problem, whether it's training standards or the amount of time they have to spend fundraising and chicken barbecues and pancake breakfasts. There's just a lot, and everybody's busier. There's a lot of demands on everyone's plate. But thankfully, we have folks who just like we have folks who want to serve in local government. Thankfully, we have folks who want to serve in fire services and emergency services because, as you know, normal people, when there's a building on fire, normal people are running out.
Exactly.
These very special, dedicated volunteers they're running in. They're running in to save lives and save structures.
And to help with that, you probably have things that our viewers can get involved with, besides just going to their local governments and local volunteer fire companies. But do you also have things to prepare them, to sort of have the right pathway of how to interject themselves, into this process and to know that they're wanted?
Well, I think from a recruiting standpoint, there's always outreach, whether that's in other citizen groups, volunteers, ballpark activities, athletic leagues, retired military folks. There's in many cases family members who just pass that along. We work with some of the schools to try and engage students in becoming volunteer firefighters and trying to develop a program for the community colleges as well.
So there's a commission that's been put into place, and I understand you're also calling for a special session to address this issue. Can you talk about both of those issues?
Sure. At our conference, our outgoing president, Cheryl Barnhart, who has been a lifelong career volunteer firefighter and an EMS provider, and still makes calls on the ambulance, detailed the history and how there used to be a waiting list to join a fire department.
Wow.
Now, not so much.
No.
And the real pressing need in crisis is that if all the volunteers were to go away, and there is still an obligation to provide fire protection. I mean, local governments have a statutory obligation to provide fire services. And the state fire commissioner has estimated that cost, and it's gone up over the years, that cost to currently stand at $10 billion, billion with a B. On local, and that's all local property tax increases. So the failure to act and do something now is really going to be a very expensive bill for taxpayers later.
So are they looking for state funding? I mean, clearly you're not going to get to 300,000 firefighters overnight. So how is this going to be addressed?
Well, I think the legislature, so they did this report in the 70s called Pennsylvania Burning when there were 300,000. And there was another report after September 11 in the early 2000s that talked about issues for recruiting and retaining. And now we have another report that's being prepared with Senate Resolution 6 to talk about the same kind of issues. And our president's concern was that, my gosh, we've spent the last 30 years identifying and studying the problem. We're studying it to death. It's time to stop studying it and time to start acting on it.
Yeah.
So he asked for our membership to ask for the governor to call a special session, which they unanimously did and passed a resolution. We forwarded that to the governor's office and members of the legislature. The response, and then the point there, I mean, some people are just saying, oh, it's just window dressing, but the point there is that it's to really bring laser focus to the issue and be able to talk about those issues and not have them muddied with welfare reform or some other issues that are out there where you have trade-offs. And let's just talk about fixing this problem. And the governor's press office response was immediately, "Oh, that's window dressing." We continue to have conversations with the governor's office to try and bring them around, and the legislature is the House has been more embracing of the concept, but we're still working with both of them to try and move the bills. But there's things that can be done in the short term. You don't have to wait until the report's due in November, which will be then not dealt with until next year.
Exactly.
Right, and there's many things that can be done because state government is involved and the federal government involved in all the local government. But the people, especially volunteers, they get the job done, they do it, they don't complain. But all the dollars that we go in, for instance, any kind of economic development that goes from any other entity should have a little thing on there besides saying, well, how many people are you hiring? What type of people are you hiring? It should also be, what's your policy on allowing volunteers to volunteer, during work hours? I think that that's something that should get a grade on there about, how they're interacting with the community on emergency services, because they benefit by having their company there with fire service.
Absolutely.
And so right now, a lot of people have that trouble that they can't, leave their job, like in the middle, there's not that. But I think having people really talk about it, that's why I think a special session is really great to bring attention to it, just like with the opioid crisis that's impacting all the local governments now. Bringing that together to say, hey, we need to do something about that, elevating that, will then get people to volunteer and say, you know what, I should be doing that. If I can't put out a fire, I can certainly raise funds so that they don't have to take that away, because they're already spending so much time being trained of how to go in and fight the fire. They shouldn't have to worry about selling chickens. I should be out there raising money for them, so then they can just do the training and put the fires out.
Right. I think one of the things that you raise from that perspective is very important. I mean, one of the ideas that's been promoted, and your question is, where's they going to get $10 billion? Well, nobody's looking for a check for $10 billion.
Right.
But they're looking for relief from mandates and relief from some of those fundraising pressures. So one of the proposals is to allow for tax credits for employers to allow their employees to respond to volunteer fire services. There's another one that will say, in the 90s there was a great nursing shortage. So the legislature decided to provide tuition reimbursement.
I remember that, yeah.
Well, maybe now it's time to do tuition reimbursements or tuition offsets for volunteer firefighters. There are other things that, somebody has to do the books at the fire department. Not all the fire services are involved in running into burning buildings. There may be a way to get CPAs, continuing education credits, to volunteer to take the business office side, the back office side of firefighting.
Those are all great suggestions. And I can't believe it, but we are out of time.
Can't believe it. Yeah, thank you so much.
We need to have you back to find out what's happening with the firefighters, because it's so essential to our local services. So we want to thank you very much for being
and all
here
our
with
local
us today.
officials.
And all our local officials, all
Thank
of them.
you.
And we'll be back next time on a new edition of Behind the Headlines.
Behind the Headlines is brought to you as a public service by the Hospital and Healthsystem Association of Pennsylvania, helping hospitals provide healing, health, and hope to communities across the state. And by the Pennsylvania Chamber of Business and Industry. The Pennsylvania Chamber serves as the frontline advocate for business on Pennsylvania's Capitol Hill by influencing the legislative, regulatory, and judicial branches of state government. Additional underwriting provided by the Worrell Corporation Foundation, based in Carlisle, Pennsylvania, by the Edward H. and Jeannie Arnold Foundation, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business. Behind the Headlines is also supported as a public service by the Pennsylvania Highway Information Association.